Okay, thyroid glands. We're going to talk about the thyroid gland. Thyroid gland is that butterfly-shaped gland that's in the front part of the throat. Okay, it's on the trachea. On the back part of it is the parathyroid. So if we dissect that out and you feel in the back, usually anywhere from 2 to 6 parathyroid glands. Generally, there's 4. Okay, on average. Thyroid gland is going to release T3 and T4. T3 is going to be the more metabolically active form. Okay, so even though the thyroid gland is going to make T4, when it gets out to the tissues, quite often it's converted to T3. Okay, so thyroxine and triiodothyronine. It increases basal metabolic rate. It makes tissues become quicker in their activities. It'll raise the temperature in our body. It'll promote the use of energy or glucose in the body and oxygen. Okay, so it's going to increase basal metabolic rate, heart rate, blood pressure, breathing, etc. Okay, there are several things that can go wrong with the thyroid. Okay, so the 2 major groupings, let me sort of clarify this a little bit. Okay, so the 2 major groupings of pathologies that can happen with the thyroid are going to be hypothyroidism, okay, or hyperthyroidism. Okay. So hypothyroidism would be a disease process in which the thyroid is not going to be releasing T3, T4. It can just be congenital or idiopathic. The basal metabolic rate for that patient would decline. Okay, so hypothyroidism, their basal metabolic rate would decline. They would tend to be colder. They would tend to put on weight. They would tend to be more tired. Okay, so that hypothyroid syndrome is the first thing on this slide. Okay, some of the signs and symptoms are called myxedema. Okay, so myxedema. It's going to be hypothyroid syndrome where you see a patient get tired, cold, and overweight. Okay. Now, hyperthyroidism, there's several things that can cause this. Okay, the one thing that we're going to talk about is Graves' disease. Okay. Now, Graves' disease is an autoimmune disease. Okay, so for some reason, this patient's immune system does not recognize the thyroid tissue as its own and starts to attack it. Okay, as it attacks it, it can become, for lack of a very brief description, can be filled with connective tissue. Okay, specific areas of thyroid can get swollen, and people with Graves' disease can get a condition called goiter. Okay. So goiter, and this is the picture that I have on the slide for you. Goiter is an enlargement of the thyroid because it's not functioning properly. It gets enlarged and fills with fibrotic tissue. Okay. And unless the symptoms are addressed and medications given, that will be a permanent condition. And if it's let go for a long time, it can actually be permanent forever. Now, goiter can be seen. So we have hypothyroidism, hyperthyroidism, but we can have goiter in another condition called endemic goiter. Okay, this is thankfully not seen in this country very much, but if you don't have enough iodine in your diet, which we have a ton because we have fortified salt, okay, in our salt we have iodine. Iodine is an essential component of T3 and T4. If the body does not have iodine to make T3, T4, it actually will start to work extra hard to try to make more T3, T4. It makes a lot of what's like a precursor of that T3, T4, and it stores it in the thyroid. And it will start to enlarge the thyroid because it can't complete that process and get T3, T4 out. Now, once iodine is added, that would go away if it's not let go for too long. Okay, so endemic goiter doesn't have anything to do with hypothyroidism or hypo or hyperthyroidism. Endemic goiter is going to be the lack of iodine. So there are 3 different conditions. Okay, but goiter is going to be that enlargement of the front part of the throat. Now, hopping back to Graves' disease. Graves' disease also has a condition called exophthalmos. Okay, Exophthalmos, this is on your slide as well, is a condition with Graves' disease where they get a little pad of fat behind their eye and it pushes the eye forward and the eye looks like it's bugging out a little bit. Exophthalmos, that is a permanent condition with Graves' disease. Okay, so imbalances in the thyroid. Now, calcitonin. We're going to look at the thyroid microscopically in lab, and this will make a little more sense then. Calcitonin is a hormone that's released from the thyroid. I'll show you the specific cells in lab. What it does is it takes calcium and it puts it into the bone. Okay, so calcitonin from the thyroid puts calcium into the bone. The parathyroid glands, ironically enough, even though they're a separate structure on the back part of the thyroid, parathyroid hormone is released from them. Parathyroid hormone will pull calcium out of the bones. Okay? We need to keep that balance of calcium in the blood at a certain level so we have enough calcium to make muscles and nerves work and function. Okay, so parathyroid glands are going to help to release parathyroid hormone, which will release calcium from the blood. Okay, adrenal glands. So the suprarenal glands, those glands on top of the kidneys. Okay, so we talked about the two parts. Adrenal cortex is the outer portion. There are several hormones that deal with stress. Adrenal medulla is that center portion. It's stimulated by the sympathetic nervous system to release epinephrine and norepinephrine. Okay. If we look at this closely, and if you can't see this, you know what? I'll zoom in on this. The different layers of the adrenal glands, okay, they're called zona. So there's a capsule, which is going to be a dense fibrous connective tissue around the outside. But the three actual layers that will create and secrete hormones are the zona glomerulosa, the zona fasciculata, and the zona reticularis. Okay? Glomerulosa is going to be the one on the outside. So if you look at how they've taken one small section of the adrenal gland, the adrenal cortex, I should say, and blown it up, surrounding the outside of that cortex, we're going to have these three layers. Okay? Zona glomerulosa, zona fasciculata, and zona reticularis. Those three areas are the parts of the adrenal cortex that are very important for the release of hormones. Okay? The adrenal medulla, you can see at the bottom, we already talked about that. That's going to release epinephrine and norepinephrine. Okay? So adrenal cortex, I'm going to keep this zoomed in. Okay? So there are those three layers, glomerulosa, fasciculata, and reticularis. Glomerulosa is the most outermost or superficial. Fasciculata is in the middle. Reticularis is towards the center. Glomerulosa, this is brutal memorization, okay? So you got to go through and just repeat these until you have them memorized. Glomerulosa releases mineralocorticoids, okay? They regulate the balance of sodium and potassium. So if blood pressure starts to drop, okay, this mineralocorticoid, specifically known as aldosterone, will be released. It retains sodium. If you retain sodium, you retain water, okay? And it'll dump potassium. So the whole purpose of this is to help to regulate the volume of blood that we have in the body, okay? So the mineralocorticoid that we were talking about is aldosterone. Aldosterone does other things as well. It's a very potent vasoconstrictor, which will also raise blood pressure. If you decrease the diameter of a tube, it'll increase the pressure of fluid in it, okay? It also retains sodium, which will increase blood pressure. Fasciculata is a glucocorticoid that regulates metabolism. It balances blood sugar levels. Add on here, the glucocorticoid that we're specifically talking about is cortisol. So from the zona fasciculata, we release glucocorticoids, specifically cortisol. Okay, balances blood sugar levels. Zona reticularis is the innermost one that releases gonatocorticoids, mostly androgens. Okay, androgens is a very weak creator of testosterone and estrogen. It's not going to be the primary area that we get estrogen and testosterone. It's sort of like a backup plan. Kicks in during like teenage years, and especially males, and during menopause in females. Okay? So those are the three layers and what hormones are released from them in the adrenal cortex. Okay? Cushing's disease, I'm going to keep this in again because I think this is a good picture. It's an increase in the release of those glucocorticoids, okay? Specifically cortisol. It keeps a lot of sugar circulating in the blood. And two of the signs and symptoms of this is a very round, what's called swollen moon face, or facies, some physicians say. You also get a fat pad over like C7 area in the back of the neck. Okay, now that is actually called buffalo hump in this condition because it looks a little bit like the buffalo hump that we see in buffaloes out west. Okay, so Cushing disease is going to be an increase in levels of cortisol in the body due to a disease that'll affect the release of that and overstimulate it. Patients can get a swollen moon face and fat in the posterior neck. Adrenal medulla, we talked about this, is going to release epinephrine, norepinephrine with sympathetic facilitation. 80% is epinephrine. Now, epinephrine is going to be the primary controller of the sympathetic response. It'll increase heart rate, it'll increase blood pressure, increase the release of stored glucose, okay? Norepinephrine is more used as a neurotransmitter in the sympathetic nervous system, okay? Pancreas. Now, if we think to the pancreas, it's right across the abdomen. The pancreas has a couple important physiological processes, okay? So there's an exocrine portion, which is made for digestion, and it's made up of what are called acinar cells. We will see these in lab, these acinar cells. They surround the area that has the endocrine function. So we have an exocrine portion, we have an endocrine portion. The exocrine portion is for digestion. It secretes by a duct to the surface of the intestines. It releases digestive enzymes. Okay, so exocrine portion releases digestive enzymes. We'll look at the cells in lab. There's also an endocrine portion. Now this endocrine portion, I'm keeping this zoomed in once again. This endocrine portion is made up of what are called the pancreatic islets, or islets of Langerhans. Okay, you can see them when we look at the pancreas. There's little different staining grouping of cells. Now, inside that pancreatic islets, there's actually different groupings of cells. The two groupings we're going to focus on, there's more than this, but the two that we're going to focus on are alpha cells and beta cells. Okay? Alpha cells release glucagon. Now, glucagon will release stored glucose. Okay? Alpha cells in the pancreatic islets will release glucagon, which will stimulate the release of stored glucose. Now, if you could think for a minute, why would we want to release stored glucose? We would want to release it because we don't have enough glucose in the blood. So in areas such as the liver where we have stored glycogen, glucagon will stimulate the release of that stored glycogen, break it down into glucose, and put it into our blood so we have enough glucose in the blood. That's what alpha cells in the pancreas do. Beta cells, on the other hand, release insulin. Now, insulin is super important because it carries glucose into cells. Okay, so let's talk about this for 2 seconds. Insulin is a hormone, it's a protein-based hormone that's released from the pancreas that will take glucose and put it into cells. When we talk about metabolism, next week or the week after, actually 2 or 3 weeks, when we talk about metabolism, glucose cannot enter a cell without insulin. Now, the only place that we can make ATP, once again, we need glucose and oxygen to make ATP. The only place that we can make ATP is inside a cell. We need to get glucose into a cell in order to make energy, or ATP. Insulin has to carry glucose into the cell in order for glucose and oxygen to create ATP or energy. So glucagon takes stored glucose out of cells, insulin puts it in, depending on how much glucose or sugar we have in our bloodstream. Okay? And that's a constant balance because we eat, we have insulin released, we go into phases of starvation, glucagon is released, so it's a back and forth thing. Okay? Diabetes mellitus, we're going to talk about this specifically when we get into metabolism. I have actually several slides about this because it's super important. Diabetes mellitus is the inability to secrete insulin from the pancreas or the inability of insulin to get glucose into the cells. There's 2 types. Type 1 is the inability to release insulin from the pancreas. We're going to totally get into this specifically in metabolism. Okay, so if this is not making sense, bear with me. What I want you to remember is diabetes type 1 is the inability of the pancreas to secrete insulin. Type 2 is the inability of insulin to put glucose into cells. Okay, so there's two types, two causes of them, two effects, well, similar effects, but okay. Three signs though, three very pathognomonic signs for diabetes mellitus is polyuria, polydipsia, polyphagia. Because the body doesn't have the ability to put glucose into cells, your body thinks it's starving, okay? So you're hungry, you want to keep eating more because your body thinks, well, I don't have enough energy, I need more glucose, let's eat. Polyphagia is the actual physiological term for that, okay? Polyuria is the excess excretion of urine. When you get high levels of glucose that stay in the blood, they're not put into the cells to use for energy, that high level of glucose tells the body that it needs to be excreted. Okay, it actually doesn't tell it needs to be excreted. It actually sort of surpasses the levels of glucose that can be maintained in the blood. It's excreted through the urine, which is totally abnormal. When it's excreted through the urine, we try to dilute it with more fluids, okay? So we excrete more urine with the glucose and more fluids, polyuria, okay? Polydipsia is excessive thirst because we're getting rid of the fluids. We're very thirsty. Our thirst centers in the hypothalamus are saying we need more fluid, okay? So we're eating, we're drinking more, and we're excreting more fluid. So three pathognomonic signs for diabetes mellitus. Okay, gonads, male and female sex hormones. We're really going to get into these the next few classes when we talk about reproductive. I feel like we need to talk about the structure first, then we can talk about the physiologic processes of these hormones, okay? Estrogen, progesterones, okay? Estrogen causes maturation of reproductive organs. Progesterone and estrogen help breast development in menses, and I should put in pregnancy there as well. Okay, testosterone created in the scrotum of males helps to produce sperm and male sex hormones. Okay, last two. Now this is, sorry, an old slide. We won't see you next semester. Okay, a couple more classes. Pineal gland is this neat little gland that sits at the base of the skull. It releases a hormone called melatonin. Melatonin regulates your sleep-wake cycles. It peaks at nighttime when it's dark, and it goes to lower levels during the day, melatonin. And the pineal gland helps to regulate that according to light, okay? The pineal gland releases more melatonin when it's dark and less when it's light. Now, the interesting thing is that people that work at night don't release as much melatonin when they're sleeping during the day. It affects their ability to sleep well and to get rested. They aren't as rested as they would be if they slept at night. I hate to tell you this because I know a lot of you are nurses and going into night shifts. It also decreases some antioxidant properties of melatonin. Melatonin, they're finding, has some anti-carcinogen effects. If you don't release as much melatonin at night when you're sleeping as you would if you're sleeping during the day, you're not going to have as much anti-carcinogen effects, and there's a higher link of cancer with people that work at night for prolonged periods of time, okay? Don't go out and freak out and think, oh my God, I can't work at night now. But if you work at night for years and years and years and have a lot of stress and correlating factors, there may be some problems with higher incidence of cancer, okay? Not totally confirmed studies, so don't freak out. The thymus is deep to the sternum. It aids in the immune response, okay? It helps with the formation of T cells, okay? T cells are specific cells that will help to fight off any infectious agent that we had in the body. Okay, that is it for endocrine. Please, if you have any questions whatsoever, get a hold of me. I know that's a chunk of change of information. I'd be happy to help you if you need any help. Thanks, and we'll see you next week.